Hi, I'm Dr. Park,
Hello, I'm Dr. Giglu.
and today we're going to go over tooth replacement from a single tooth all the way, so multiple teeth to all teeth. So it depends, every patient's a little bit different. So we're going to go through these options for you, okay? All right, so first we're going to talk about when you're missing a single tooth and you're looking for some kind of temporary solution. This product is called Temp Tooth. And what you do is you warm it up and you're able to kind of mold it with your fingers and make some kind of temporary tooth in the meantime. And so let's say you have this temporary solution in your mouth and now you're making your way to the dental office. Um, what are some options? What is your first thing that you're thinking for a single tooth?
Sure. So if you lose a single tooth, basically you have three options. One is to do nothing. If you do nothing, what's going to happen over time is the adjacent teeth to this space, they're going to shift towards each other because teeth, they like to touch each other. And also the opposing teeth from the opposing arch gonna drift downwards. Obviously, this is not an ideal situation, and what's gonna happen over time is you're gonna lose the bone in this area as well. The other classic option is to have a dental bridge. So dental bridge is basically you are shaving down the adjacent teeth and then you connect them with a fake tooth, also called a pontic in between. As you can see, in order to achieve that, you have to shave down the teeth in these areas. Sometimes those teeth, they are healthy teeth, and obviously that's not an ideal situation. So Dr. Park, from your experience, what are some pros and cons to the having the bridge?
Okay, so in terms of having a bridge, let's get into kind of the cons immediately. You kind of touched on it already. If you do have two healthy teeth here, and you're trying to replace this single tooth, unfortunately, you're going to have to trim these teeth. So these are going to be called your abutment teeth. And then it's going to replace a single tooth here, which is called your pontic, and you'll have it there. Okay. Another con is because you don't have a tooth there over time, as you had mentioned, the bone and the soft tissue in this area will kind of start to resorb. And the gap, you'll develop a gap underneath this pontic. And so that becomes a problem in itself because now you have a food trap that can possibly cause some decay or some periodontal issues with these abutment teeth here. So over time, it's very difficult to maintain the hygiene for these, and these pontic teeth become very vulnerable to hygiene issues and decay and perio and stuff like that. And obviously the pro is, you're getting that fix. You're getting that area corrected with, the pontic, and you're maintaining the spacing and your occlusion and the aesthetics of it.
Okay. So the other option is dental implant. Here you can see a dental implant. Basically, a dental implant is a screw made out of titanium that we place inside the jawbone with certain width and certain length. So here is the actual size of a dental implant, and here is a model that we can use that so you can see that you place this dental implant inside that jawbone. So the benefit of that is you treat this space as a single tooth. And then when you have the crown on top of the implant, you can floss between the teeth and do the hygiene of every single tooth independently. In order to be able to place the dental implant, you need to have solid bone. And sometimes, if you don't do it immediately after you lose the tooth, you may lose the bone stock necessary for placement of a dental implant. In that case, you have to go to your surgeon and they may do some additional steps such as bone grafting in order to prepare that area so you can have the dental implant in that space.
Mhm. And just to add to that, when you're looking at two options, you're looking at the bridge option versus the single implant. The single implant is considered more conservative treatment because these two teeth are not being trimmed, and you can maintain the spaces between the teeth. So you're going to be treating these as individual teeth, brushing, flossing, and being able to maintain all three sites.
That's right.
So let's talk about the cost for these treatments. Let's start with single tooth implant.
Yeah, for a single tooth implant, considering the implant placement and restoration, depending on different parts of the country, it can range between $4,000 to $6,000.
Yep. All right. And then if we look at a 3-unit bridge, because each individual site is considered a crown, this itself would also be considered approximately $4,000 to $6,000, which is kind of surprising. Obviously, you're
Yeah.
not going through any surgery, but as discussed, you are including the adjacent teeth part of your treatment, and that's what causes the material cost to go up. Let's say you're missing more than one tooth.
Mm-hmm.
So we've got these little bad boys. This one comes with multiple names. This is a partial denture. It could be called the transitional, it could be called the flipper. The reason why it's called that is because there is only acrylic and then there's some little metal clasps here. So this is a really temporary solution um, before you move on to something like this. This is a cast metal partial. So these are considered more of a final restoration versus something like this, where this is more of a temporary solution. I would say this, in terms of cost, will run you a couple $100 because, like I said, this should only be worn maybe 6 months, hopefully less, until you can get into something more permanent. If you want something removable, this is more permanent. This would cost maybe around $2,000. But again, it is removable. It's not the prettiest. And, you know, then we can talk about more fixed solutions for multiple teeth.
Absolutely. So, as Dr. Park mentioned, these are somewhat less ideal options when you're missing multiple teeth. One of the options that you have for some fixed prosthesis is that, let's say, you're missing three different teeth that are next to each other. You can, if you have enough stock of bone, you can place separate implants in these areas and then cover them with separate crowns. The other option would be to have a bridge supported by dental implants, meaning that you place an implant in this location and in this location and you connect them with a bridge, similar to the bridge that is supported by a natural tooth, but in this case, the bridge is supported by dental implants. And the cost for this option depends on the location that you are in the country and also the number of implants placed and the number of teeth that are restored by those implants.
All right. So we've just discussed missing multiple teeth with partials, some fixed options. And we've got this,
What is that, Dr. Park?
as seen on TV, Instant Smile Comfort Fit Flex. So in my professional opinion, obviously this is not a great solution. It's not a permanent solution. But if you're in like a tight bind, obviously everybody's dental needs are different. And if you're in a tight bind and you need something just to get by, you know, you can use this product. It's kind of where you put in hot water and you stick it on the front. So it's kind of like a removable veneer. And if this option is something that you may need to consider in the temporary, we do have Dr. Arnoti with Nuvia. They actually tried to do this product to see how it turned out. So check out that video if you want. But like again, like I said, this is very temporary. You can use it just before you can get to the dental office. But
So, Dr. Park, what happens when you lose all of your teeth?
yeah, in that case, we can start with this product. This product is you can buy online. It's called Easy Denture. It's very similar to a couple of the products we talked about today, where you put in hot water, and obviously the patient has no teeth. They have put in hot water. They put it in their mouth. It forms to their ridge, and you have a temporary solution replacing all of your teeth.
I see.
And so, you know, initially when I first saw this product, it's good border molding. So it's nice and molded here. But it's hard because this is it seems like it's a one size fits all solution. So this may not work for you. It's going to be very difficult to kind of go online, purchase something like this, and have it actually fit correctly. And so that's why we kind of move towards going to the dental office, and we have a complete denture here made by a dental office. So kind
Custom made.
custom made. So you can see there's a lot more anatomy of this patient's roof of the mouth, nice borders, and then obviously the teeth are custom length to make sure everything looks great.
So what are some downsides of having a custom made dentures?
Yeah, I mean, there's so many I can go through, but the biggest one that I hear when working at Nuvia is, "Hey, I moved to a denture and now I'm not tasting my food as
That's right.
much." Because, yeah, 90% of your taste buds are on your tongue, but you're missing the roof of your mouth,
Hmm.
and you're still being able to taste through the roof of the mouth. It's very difficult when this full palate is there. This is there because you need that suction. Otherwise, this thing flops around.
Helps with the stability of the denture.
Yeah. But as you get older, unfortunately, things shrink. Your bone shrinks, your soft tissue shrinks. Over time, a denture definitely needs to be replaced every, I would say every 2 to 5 years. Every patient's a little different, but these are approximately $2,000 to $5,000 for a single denture. A big downside for dentures is bone loss.
That's true.
If you want to go into a little more detail
Yeah,
about that.
sure. Let me make you a quick diagram here. Think about this as your lower jaw, and think about it, that's like a half of your lower jaw. Think about the denture sits over this area.
Hmm.
So what happens, because there is no tooth in that area, what happens is over time you start losing bone. So your bone level from this level comes down to this level. Also, there is a nerve that runs under your jaw that gives sensation to your lower lip and your lower jaw. And it comes down from a hole inside your jawbone. So, what happens over time, you start losing bone more and more. And what's going to happen is the denture is going to start rubbing against this nerve. And that can cause also pain and some discomfort. And as you lose the bone, the amount of bone gives stability to that denture. So with less amount of bone, the denture over time going to become less stable. If you wearing a denture and you wait a long period of time, as you can see, you're gonna lose significant amount of bone, and that's gonna limit the possibility of placement of dental implants inside your jawbone. So if you have problems with your dentures, when your dentures are not stable enough and they are rocking, so one of the options is to place some dental implants inside your jawbone. That way, the denture is more stable. So in that's going to segue to the next option that we can talk about is the prostheses that are supported by dental implants and they are removable. So the idea in this scenario would be that you place 2 to 4, sometimes more implants inside the jawbone and the denture gonna snap in into those areas. As you can see in our models, this is a top jaw. 4 implants are placed inside the jawbone, and they have these parts, male and female, that the denture snaps into place in those areas. So that gives stability of the denture, and then also it limits the bone loss associated with loss of teeth in those areas.
All right, so kind of doing a summary over the implant overdenture. It's removable. It's technically a little bit more cleansable because you could take it out at night. You should be taking it out at night, keeping it clean.
Yep.
The abutments here, this model doesn't show it, but you have little nylon buttons that are there that help clip the prosthetic into place. Those do have to be replaced.
Wear and tear.
Yeah, wear and tear, which is normal because you're taking them on and off. on and off. And so those buttons wear out. Typically, with those cases, you're replacing it every 6 to 12 months, depending on wear and tear. And this is still kind of the full palette. This option has the full palette. It still has the full extensions that go into like the vestibule. So it's still pretty bulky. The cost, if you're wondering about cost for this could be around 10 to 15,000 per arch. And so that's the removable option, implant removable. And now we're going to get into the fixed
Fixed.
options. And at any time during this video, you have questions about the costs for any of these options, go down to the description below and you'll see the cost guide.
So if patients are asking about some of the fixed options, meaning that they're not happy with the fact that in this case, the denture, it is supported by implants, but it can be removed. And to be honest, there are some benefits in this scenario for some patients. For example, if the patient does not have the best dexterity, that can be a very good option because the fixed option needs a lot of cleaning and hygiene. And this option is much easier. Or for some other medical conditions, there are some very good indication to use this option. But if the patient is more interested in a fixed option and everything else is okay from the dexterity point of view, is we can place certain number of implants in jaw, top jaw or lower jaw, and attach the fixed prosthesis to those implants. So the historical name for this procedure is called all on X, meaning that all the teeth are supported by X number of implants. And that X can be between 4 to 6 or more. So historically, the idea would be that you place 4 implants. Let's say this is your top jaw. These are your maxillary sinus, that there are big holes inside your face, and you place 4 implants in this fashion. And the prosthesis will be attached to those 4 implants. Obviously, this is going to be your nose. This is going to be your maxillary sinus. And the prosthesis going to get attached to this area. So this, as you can see, going to be a fixed option, meaning that the prosthesis, we're going to talk about it, is going to get attached to this area and it's going to be fixed. And the cleaning parts will be on top of it and also on the bottom of it. Okay? Dr. Park, could you please elaborate a little bit about the prosthesis part of the implant-supported fixed prosthesis?
I know. It's a mouthful.
Mouthful.
I know. So here we have the traditional all-on-X prosthetic, as I was kind of trained on. I've
Yeah.
done multiple prosthetics like this. I'm sure you
Yeah,
have
I
done
have worked
yourself.
with, yeah.
You actually start off with this in surgery. After you've placed those 4 implants, you put the denture in the patient's mouth. Right after surgery, you drill out these holes in the denture and attach these metal cylinders to the implants. Then it's a lot of lab work. You go in the back, you're trimming the extensions, the palate off, and polishing up, trying to make it look pretty. Obviously, not the prettiest prosthetic you've seen, but this is what is called teeth in a day. And this is a technique that was developed in the late 90s.
Yep.
So over 20 years. Even today, still some practices are probably doing it this way. But we can go into the pros and cons of these, but we'll go into talking about the Nuvia way.
Yes. As you can see, this is the Nuvia way, and you can compare it to the traditional way. So the first thing that comes to mind is the quality of the material. The reason is this material is basically plastic. It's liquid and powder that have been mixed together. And with that material, there is some flexibility in that prosthesis, meaning that when you attach it to the denture, as the patient starts chewing and function, there is some flexure in that material. And the problem is that flexing will get translated to the implants. And the worst thing for implant healing and stability, especially in that 4 to 6 month critical healing time, is if this implant starts moving, there is a chance that that implant is going to fail. Whereas in this scenario, the Nuvia way, the material is way, way more robust. It's zirconia based, and there is way less flexure associated with this material compared to that material. So the important point about is in both cases, you're going to end up with a final material that is similar to this. In the traditional way, you're going to be in the temporary material for 4 to 6 months before you get it to the final material. In the way that Nuvia does it, the final material is delivered to you immediately in 24 hours. And that separates the two different systems.
Let's say our moms come in and
Yes.
want to get this treatment
Yes.
done. You need something as strong and rigid. And so obviously we would go with the stronger material. We are respecting the healing process. That's why we're trying to push, these stronger permanent materials 24 hours after surgery. So I think we just covered everything on the table
We
here.
did.
Not bad.
Very good.
If you have more questions, financial questions about the cost of any of these products or any additional dental treatments, Nuvia does have a cost guide. We'll have it available in the description below. And if you want to learn more about Nuvia's process, I've done a deep dive here.